and I had a pretty basic request, which was a trial that gets us to drug approval. And this all started really thinking about my patients in clinic. And I had a recent patient actually last week who's a 14-year-old kiddo with significant pulmonary hypertension after a congenital heart disease repair, who had been on tadalafil and ambrisentan and gotten better on those drugs. And then his insurance changed, and the insurance has said, no, we won't pay for those drugs. The reason being because they're not approved and for children under 18. So then, the pharmacy who'd been supplying them called his mom and said, we can continue to give this to you, and the monthly cost is $12,000. So now essentially this kid who had a good response doesn't have access to these two drugs because we don't have FDA approval for those drugs in children. And this is a chronic problem. There's actually only 2 medications approved for children in the United States for pulmonary hypertension, sildenafil and bosentan. The remainder of everything we use very effectively is all used off-label.
That's absolutely an awful story to hear. So thank you so much for sharing that very recent story. Am I right in thinking this is not an uncommon story?
This is not uncommon. When I think about what the impact of the regulatory environment and the lack of approval, what impact it has on our patients, it means it's difficult for them to get drugs. We can't get pediatric formulations. So I talked yesterday about my parents who teach me parents who I see in clinic who teach me how to chop up pills and how best to dissolve them. And the thing they taught me was the best way to dissolve it is to use hot water from the coffee pot. Pills dissolve better that way. But we don't know how best to do it. We're dissolving and cutting up adult medications because we don't have pediatric formulations. And we don't have pediatric formulations because we don't have pediatric approval.
We really hear you on that. What can we do as a global PVRI community to help?
Well, I think getting trials that actually qualify for endpoints to say that this drug is safe and effective in children. And we have lots of trials actually showing that it's safe, but many regulatory agencies are not going to just accept safe. They want to show that the drug is effective to treat the disease. So we need to prioritize the pediatric clinical trials showing efficacy and getting to that endpoint of regulatory approval. And I'm speaking from a United States perspective, but it's not just the United States. The European Medicines Agency has done a lot of work, and they have actually the most drugs approved, but most countries in the world don't have access to these drugs for children. And for example, one of the best classes of pediatric or of pulmonary hypertension medications, prostacyclins, there is not an approved prostacyclin anywhere in the world for children. And we've been using these medications for 20 years. We've been using them safely for children in 20 years, but it's all off-label, which really limits our ability and our access to get these meds to the right kids.
Well, thank you very much for speaking with us today, Megan.
She did do a phenomenal job, and really what she got to the heart of is access to medications that we have decades of research on, not only in adults, but in children, but are not yet approved for the treatment of pediatric pulmonary hypertension. And the question is why? And really, that's a fundamental question that we all have various answers to or hypotheses, but none really sufficient enough to say, yes, there's an adequate reason as to why we have not approved medications that we have decades of knowledge on and data on. So fundamentally, what can the PVRI IDDI do to address this? And I want to credit our pediatric colleagues for being steadfast in their request to gather assistance in this effort. And we actually discussed this yesterday following the meeting as an IDDI leadership team. It was so impactful for all of us in the room that truly the first thing we discussed was how can we assist in this effort? It's time. And so we did discuss methods, novel methods, but there is precedent for reviewing the data, the historical data that exists, not just in adults, but in children with the off-label use, the decades of off-label use of these medications, and how we can assist in data analysis, and then certainly leveraging our partnerships, our multidisciplinary partnerships with industry members, with regulators, and ultimately the goal would be to file an application with a medication or medications that we believe meet the criteria. It's fundamentally, yes, there is absolutely something we can do. We will try our best, but we agree it's time.